rudimentary model. Oh, and we're recording the meeting now. And so that's what we're kind of doing today. We're in the in between sort of mindsets and maps, and you see the examples there on the left. That's a whole systems map. That's what we're going to be doing today. It's kind of just a table, but when we call it a whole systems map, it helps frame it into this broader context. The other examples there are just more rigorous maps. The one in the middle is the state opioid systems map that Georgia Health Policy Center helped out with, and DPH and other stakeholders in that system to map how people and money move through the system and using different approaches. The one on the right is a more relational kind of map. I forget exactly where that comes from, but it's just to show what these maps can look like, and there's a lot of different forms to them. But before you get to the maps, and so the mapping takes a little bit of training, a little bit of coaching to get into it. You sort of need to understand the tool and how to use it, but they're really much more these collaborative spaces where people can frame their ideas and share. But to get to the maps, you just need to have a systems mindset, and that's the most basic level that we want to make sure everybody is on the same page of what is the system, how are we thinking about the work each of us does in this space, how it's interconnected with other parts of the work. And so often systems mindsets are just spurred by strategic sets of questions. The 5 R's is one version we've used a lot with some of our work in the maternal and child health space. GHPC years ago created a 6-question framework for evaluating policy specifically. And again, it's just relatively straightforward and simple questions, but thinking about these questions about who, what, how, and then the connections between them, that starts to help you think and see in systems. And then on the right there is the iceberg framework. That's a pretty common systems image or metaphor for the way we talk about systems. And I'll touch on that a little bit, but I'm thinking we might go more in depth on the iceberg in the part 2 of this session. So know that there may be more iceberg coming. But a formal definition of systems from Danella Meadows, who's an old-time systems guru, is a system is a set of elements interconnected in a structure that produces a characteristic set of results. And it's important. There's 3 parts to that definition, and they're each part of it that lead to what the full system is. So a system is a set of elements. Here it's a car, but it's all the pieces of it. They're not interconnected yet. We're not thinking about what are they producing. And this is kind of where we are today, or where we want to step back and think about what are the elements in this system. And then we'll start to think about how they're interconnected. Here in the example, you can have this set of elements, they can be interconnected, but in this case, it's not turning into a car. It's turning into these sculptures that serve a purpose and may be nice to look at, but they're not the characteristic result of a car. Assembling the elements of a car into a structure that produces the characteristic result of being able to get from point A to point B with 4 wheels rolling on the road, that kind of thing. So it takes all 3 pieces of those. And what we want to do here, again, is zoom out, think about what are the elements? What are people doing? Then get a little more into how are they interconnected, and then thinking about characteristic results. That's where we're going to start to bring in some of the measures and the specific programmatic kind of goals. Like what are we trying to influence? What are the results we want the system to achieve? But first we need to look at what's the current system achieving, because the design of the system gets the results it gets. So there's something in the design and the structure of the system that we want to be influencing through this type of work. So when we think about systems, everything's a system. We're all part of one big universal system. We're part of a global ecosystem. We're all parts of organizational systems. Our own bodies are systems. Within our bodies, we have the circulatory system. We have the lymphatic system. We have all these different systems all nested within each other. And the example here, carrying the sort of cars and transportation forward, on the left, that the exhaust system, there's subsystems within an individual car that the mechanic is going to need to know those pieces of the system and know the details of that exhaust system and the electronic systems within a car and whatever it may be. And that's the expertise needed to navigate that bounds of the system of a single car. In the middle, you can think about the highway system. Our road transportation system is another system that has a whole different set of perspectives, a different set of people interacting with a different type of expertise. Here you got your civil engineers and maybe community advocate groups that are pushing for or against the building of highways to move. All those cars are little systems nested in this highway system. And then on the right, is a multimodal transportation system. So that starts to think not just about cars, but people on bikes, people on transit. Freight movement is another type of transportation system. And so that illustrates how, when you say the transportation system, there are different parts of that system that you can be thinking about. And then how does that system interact with community development patterns and those types of things? So the idea of a system is a really transferable and powerful concept to be thinking about. What do you do? How is that nested in a larger system? And then so forth and so on. And part of the discussion today is to try and think about what are the boundaries of the system for obesity prevention through farm to early care and education. How do we want to define the bounds of that system for this work, for this discussion today? No matter what you're working in, it's affected by systems of interconnected elements. And that's the key piece here. Again, we're trying to figure out who we, the people on this meeting right now, are elements in this system. And what we want to talk about today is like, how are we interconnected? How are we doing things together? What are we doing as a system? And then rarely do you get a chance to completely restructure a system or start from scratch. We're always working in existing systems and trying to adjust those structures. So here's just kind of two tongue-in-cheek examples of the system of a dining room table. And the purpose of that system, or the result you want, is everybody to be able to sit at that table and talk to each other and eat, have a meal together. But something wasn't working for that chair there that it's showing. So rather than toss the whole table out or go to a different restaurant or whatever it might be, they just changed a part of that table system. They changed the structure of that chair so that it was able to then get to that result of having everybody sit at the table equally. On the right, this guy needed to change his system of his bicycle to be able to transport things. So he changed the structure of that bicycle system to add a basket to the front. So just thinking about the existing systems, describing those, and then identifying the places where we want to intervene and change the system to potentially get the better, in our case, health outcomes that we want to see. So using systems thinking helps tap into mindsets and mental models, and we'll talk a little bit more about that in future sessions. But this really just helps a group of people that are all coming together around a specific issue as part of these systems share and think about, how do you see the system? How does you, from your perspective, how does it work? What's driving the change? What's driving the way the system is happening? And your perspective may be different from another person on this call. And these tools, these systems thinking tools, are meant to help create the space for that sharing. So we're learning from each other and driving towards that broader understanding of the system, which then helps us identify the more impactful places to intervene in the system. And then helps test the critical components that gets to those other points there. So, and the iceberg, and there's a whole presentation around this, but very quickly, iceberg is a metaphor for the system. And the events, the things we're seeing in the news, the headline statistics, Georgia obesity rates or whatever they are, that's the event. That's just above the waterline. If we get deeper in that system, we start to see, what are the behaviors that are going on in the system? What are the patterns and the trends in data and behaviors of people, as well as behaviors of the system itself, that are leading to those events? And then those behaviors are very much influenced by the structures. How are the elements of the system connected together? What are the rules of the system? What are the physical environments, the design of places? How are those things setting the context for behaviors, be they the behaviors we want to see or the ones we want to avoid? And then the deepest level here in this model are the mindsets. And that's the beliefs and attitudes that undergird your mental models. And the people in the system, they bring their mindsets. And wherever you are with your mindset, that's what's going to open opportunities for different types of structures. So if you really believe that, everybody's responsible for their own health and you just go out there and get it, that's your mindset about how you do health promotion, and that's a legitimate opinion that's out there, that's going to lead you to a certain type of policies or environments to lead to behaviors, lead to events. If you believe that there's a collective responsibility for the public's health, that we need to help everybody try to be more helpful, if that's your belief and perspective on the health system, then you're going to come in with a different set of ideas for structures that may be more supportive for a broader set of groups. And again, that mindset drives the way you think about the system. And again, in part 2, we'll talk a little bit more about people's mindsets and what you're bringing in. But today, we're really focusing in on the structural space. So, and I don't think Debbie said anywhere, but policy systems and environmental change, PSE change that we hear about, even though systems in there, that's policies, environments, the systems, the structures, all that is trying to influence that structural layer of the system to then leverage changes in behavior and ultimately improve upon the events that we're seeing. And so here, the overarching strategy for obesity prevention through farm to early care and education is to implement state level policies and activities that integrate national standards related to nutrition, physical activity, and breastfeeding to advance farm to early care and education. And so implementing, defining those policies, getting those in place, setting those standards, those are structural elements of the system that then will set the context for some of the behavior change that we're wanting to drive through our work. So again, we'll do more with the iceberg model, but want to show you where this sort of fits. And so what we're doing today with whole system mapping is trying to define ourselves as part of that structure. So whole system mapping is really just a simple set of questions in a table that helps us get that high level view, the 30,000-foot view of the systems that we're working in. And it helps us see our respective organizations, agencies as elements in that system and thinking about how we're interconnected and what we want to change. And so the product of this will be a visual, a table. We may, over subsequent uses of it, turn it into a more visually engaging format. It might turn into some maps. That's all on the horizon and where we're headed. But today, what we're going to work on is basically a table that shows those elements of the system and starts to think about where do we overlap. And we're going to give you an opportunity to, collectively make a map together, and then we're going to talk about it. And that's the chance where we want to hear from everybody else. So we stop talking and we start hearing from you, talking about your work. It also helps identify potential collaborators that are missing, other perspectives, et cetera. And so it's a table with a set of questions, and they don't always have to be the same. That's this is really making a table that describes what you want to describe in the system, and the questions are driven by what we want to hear. We pulled a lot of this content from the Maternal Health Learning and Innovation Center, which several of us on this call are a part of. That's a HRSA-funded National Resource Center for maternal health specific awardees, and we were just using this last week with them as they were thinking about setting up their maternal health task forces, which is kind of analogous to what we're doing here with these different work groups and different folks and different perspectives being brought together. So they found it as a very powerful tool to just start organizing that thinking. And most of the folks I heard from there were, oh, it's a table. We already have a table of stakeholders and that kind of stuff. But doing this through this lens helps make that more actionable. It's not just a list of who, it's a map of who's doing what and how, and then using that to guide collaboration. So steps, we want to set the boundaries of the system. I think that will emerge a little bit as we're talking, identify the types of information. We've already populated some of the columns, but if in the conversation we feel like there are other columns we want to add, we're able to do that. A third step is to have the collaborative discussion around it. That's what we're doing today, adding to it. We will leave it to your group if you might want to include others through a survey or some other way. And that's part of the next steps that we'll be able to talk about is if and how you want to get more information and more perspectives from folks included in the map once we get there, combine it all into a table, and then talk about it together and try and find those gaps, try to find those points of overlap, and then plan the next step. So it's a relatively straightforward tool with a lot of introduction. There's equity considerations. Who's actually at the table right now talking about it? Whose views are represented by proxy? Whose views are actually here? How could you use this with community members, actual people with lived experience on the ground that we're trying to serve? Their perspectives get brought into this as well. And that's going to be, I believe we left the question on there about each of you. Are there key community members that are worth talking to and bringing into this broader process? So we're, again, getting that full and equitable view of the systems. Let's see. Then here's just some maps that I feel like I've been going too long. So I'm just to show you, these are from the maternal health world. We were doing some with telehealth, just thinking about university counseling. What do they provide? Where do they provide it? Who receives the service? How are they connected to the service? How do people find their way to it? How many people are served? So that's just a quick version of one. And then here's a little more complicated one for a maternal health task force, where they're really looking across different federally funded through HRSA, different programs in each state that touch on maternal health, who's doing what in each of those, and then what do they bring to a state level task force on maternal health issues. And you can sort of just see there again, the questions, the columns are specific to that use. And so what we're doing here, finally, we're gonna make our own map. what are we trying to understand about the system? Our team thinks that we're trying to really figure out who is doing what to promote obesity prevention through farm to early care and education in Georgia. Simple. That's what we want to explore. There's a lot of complexity under that we can tease out. What are the boundaries we want to map? In our conversations, it seems like, Georgia's a geographic boundary, but there might be funding sources that are coming externally to the state of Georgia. Are we just talking about obesity prevention? Are we just talking about farm to early care? Are we talking about the intersection of those? And that's the stuff that you guys are able to feed into this conversation. What are the boundaries that we're talking about when we talk about this specific topic area system? And so what we're going to do, and Savita, if you could go ahead and pop the link in the chat there. This is a Google Sheets. This was the best way we could figure to have a document that as many people as possible can be in there at once working on it. But I'll pop it up on my screen so you see what it is. Yeah, Debbie, 1 second. And then we'll let you sort of look at your organization or add your organization if it's not already on there. Think about your responses to those questions, and then we'll come back and share with the full group, and then that'll be the discussion part for the remainder of our time, is just sort of everybody looking at the map together, talking about and sharing what they do, and then discussing. Yes, Debbie.
Jimmy, I noted in looking at the participants that a couple of the people are on maybe cell phones or smartphones, and I just wanted to mention to everyone that and Wanda, you came to mind specifically because I saw you on here. You may not be able to put or populate this today. If you would like to take a screenshot of this, if you want us to send you this table link, we'll be happy to share it. And we also will be happy to type information in for you if you're able to share that.
Yeah, so we'll be able to adapt. So I'll stop there for any sort of questions of process, but hopefully you're able to click on that, get in there, find your organization, start answering these questions. It doesn't have to be, a detailed essay or anything, but just sort of what are some of the current policy systems, environmental changes you're working on right now? What geography do you serve? Where are the settings in which you're working? So early care and education is sort of the setting. What specific populations within those are you serving? And then are there key community members we want to start thinking about pulling into some of these conversations to get that full system view? And then if you have time to kind of, how are you measuring success? Just your measures of what you're already doing. How do you consider if you're successful or not? So everybody clear? I know that was a whole lot, but hopefully now we're in the collaborative discussion space. So are folks able to get into the spreadsheet and start working into the map? All right, I see an anonymous gopher in there. That's good.
Jimmy, they are able to insert lines, right? So I think about some of the work that Decal's doing, or that Wanda's doing, or that Georgia Organics is doing. It might be multiple things. So they are able to insert rows in order to detail different initiatives, right?
I would put your different initiatives all in one cell. So we don't want to have too many rows for different organizations. So if you could sort of stack those as they're relevant. And then what we're going to do with this table after it's populated is our team's going to sort of sort through it. And then Debbie, that's where we would maybe make extra lines if that makes sense. Also, if you need to add a line, just go down to the bottom rather than trying to insert one, just I think for ease of process. But all right, see some folks in there. We'll give a few minutes to get that populated, and then maybe in the chat. Well, no, because if you're on a phone, you probably can't chat either. So if you can, raise your hand if you're unable to get into the table, so then we can know who we need to talk to and populate it for you.
Am I missing Alabama, Florida?
I just wondered if it would be helpful to share the document on the screen, Jimmy, for those who can't type in right now so they could see the actual image of the columns.
Is that not what's being shared?
Now it is. It was the slide just a second ago for me.
Hey everyone, this is Amy with Children's Healthcare of Atlanta Strong for Life. Children's is a little iffy when opening Google Docs, so I'm trying to input it on my phone. So just wanted to give a heads up.
Okay, thanks. Yeah, unfortunately, however many years into all this virtual collaboration, we've yet to find the platform that works for everybody. It's organizations sometimes don't like Google, sometimes organizations don't like SharePoint. Other things you got to have a login and it's harder to get into. So thanks for bearing with us with the technology we're trying to use. And Tina, do you just need the link to share with your folks, or would you like this downloaded offline into an Excel file?
Downloaded on Excel file, just because our team will talk about it.
Okay. Savita, can you do that?
Yes, I can.
This is great. A lot of good info in here. I will give just another couple minutes and then we'll start sharing and talking about it. Yeah, thanks for letting us know, Edward. We'll just ask you to share verbally and we'll get somebody to type it in for you when we get around to talking about it. Okay, we got 9:45 down there on the clock, and I'll just open it up. Anyone brave enough to volunteer to go first and share who you are, your organization, and what you added to the map?
I'll go first.
Great, thank you, Kia. Go ahead.
I'm with Georgia Family Connection Partnership. And we're kind of a weird organization because we have
local collaboratives around the state. And there's a Family Connection Collaborative in all 159 counties. So I did try to focus on the collaboratives rather than the statewide work. And there is a broad depth of projects related to this topic. We have some collaboratives that are focused on food access. We have a body of work that's about healthy birth outcomes. We do work around obesity prevention. There is a Family Connection Collaborative in every county, so did do that statewide. There are some, counties choose their own adventure, so I just put statewide to make it simpler. A lot of the focus of this work is within the early years of life, somewhere around zero to age 8. And a lot of it happens within Head Start, early Head Start, early care centers within schools, working closely with public health and medical centers. Particularly school-based health centers are becoming another place where Family Connection Collaboratives are starting to engage more. It varies the population. We are trying to encourage them. We always try to encourage them to sort of think about their populations of greatest need. And typically that ends up being an income consideration. So it's typically people who are in or at risk of poverty. Key community leaders that can bring to the table, Family Connection collaborative directors. And by definition, they have to have partners at the table. So or otherwise there is no collaboration. And because we typically are not direct service providers, it varies how we measure success, but typically we do sort of process measures, trying to look at how they're collaborating, how they're working together, and how they're engaging with each other.
Right. Awesome. And just want to pick up, so your geography, you're statewide, but it sounded like there's with county specific.
Yes, I couldn't pull that from my memory bank, but if you need some more specific data than that, we can provide it at a later time.
For the purposes here, I'm just going to call it with county specific groups.
I just want to add, Kia, Rebecca has also received the invitation. She's been doing a lot of the obesity prevention work for a number of years too. So we can also tag her and ask her to contribute if that would help flush it out.
I mean, I have that access to the same information, but
Great. And Akia, thank you so much for sharing first. Great to hear what you guys are doing, and Family Connections. Love it when you guys pop up on things. Yeah, Monica, go ahead.
I was going to offer to go.
Sure, go right ahead.
And for someone to jump in next. I'm Monica Griffin with Quality Care for Children. We're a Georgia serving nonprofit, and we have a number of things going on, which I think most of you know. But we are the Child Care Resource and Referral Agency. We cover 3 of Georgia's 6 regions, if you're kind of thinking metro and north-ish. Most of that work is around providing technical assistance and training to help sites improve program quality through the quality rated system, which is obviously a key system for this conversation. Another big chunk of work that we do is we're a sponsoring organization for the Child and Adult Care Food Program. If you're unfamiliar, kind of like school lunch for the ECE world. So we provide the support and training to help increase participation and help sites not only meet those program requirements for reimbursement, but really push them towards best practices. And we do that work statewide. And then in my role, I do a lot with farm to ECE, food security, value chain coordination as far as getting local foods to programs. And then we do a good deal of professional development in all things nutrition and wellness across the state.
All right. So doing all the things. Great, Kelsey, go right ahead.
All right.
Thanks for volunteering.
Yeah. Okay, so the areas that we're kind of active in right now would be farm to ECE.
What organization are you?
Oh, sorry. Duh. Hi everyone, Kelsey Sylvia with Voices for Georgia's Children. So we're covering the Farm TC space, as Monica mentioned, some of the quality rated space, things around ECE workforce sustainability, and then really anything related to public benefits. But I cover our food public benefit sector. We do our work statewide, so we work to pass either legislative policy or state administrative policy. So we really try to make sure that those policies kind of encompass the whole state and are applied to that. Some of the settings that we mainly work in are with the ECE programs, kind of through partners, kind of one-on-one depending on the projects. Like I mentioned, public benefits, advocacy at the Capitol, but also within the state administrations. And we do a lot of convening and facilitating discussions with different applicants and partners to make sure that if we're going for something that's kind of aligned in a few areas. And the specific populations we cover are, we call it whole child, so 0 to 18, but we do cover some specific adult, young adult populations if like the benefits go over into the age group. So for example, in foster care, they get certain benefits up to 26. So it doesn't always cut off at 18 whenever we're pursuing different policy opportunities. And then key partners that we can bring, we host a number of different child health focused coalitions. And so depending on kind of who we want to tap, we can leverage those partners. So for example, we have the Child and Health Adolescent Coalition, which has 80+ members from across the state. So it's really kind of as specific as we want to get. We're happy to coordinate that. And then our different measures of success are kind of by numbers and increase of different benefit programs, but also the utilization of those programs, past legislation or not, policy as well in the admin space, and then what helps increase access. So if we're able to streamline some opportunities or do something to electronic upgrades, anything that we're able to kind of make it easier for those participation members to be up.
Awesome. Great. Thank you. And I see you're chatting there. So had a few folks go. So pause if there's any sort of questions or reflections already, or we'll just seek the next volunteer to share, and then we can talk after everybody shares.
One of the things we recognize is that some of you are doing a lot of things and you might end up being able to put all of it in 10 minutes. So this is a dynamic document and we will continue to invite people to populate.
I can share. I'm Ashley Shook. I'm with the Leap Learning Early Learning Partners out of Augusta University. We're the CCR&R with Augusta University. We do professional development and training and technical assistance and advocacy work for early care educators and those that they serve. We work with Central East Georgia. We work in the early child care centers. So anything from like family child care or a center or even some Head Starts here, we work with those. We work with the educators primarily for those that are with the infant through pre-K population. And how we measure things as we look at our program participation and the increased ratings, like the QCC ratings and things like that around the area to make sure that we're meeting the needs of our participants.
And you guys probably all know, but I don't because I'm not embedded in this work. What is CCR&R? What does that mean?
Child Care Resource and Referral.
Great. Awesome. Thank you.
Ashley, I just want to mention one thing. I think you said QCC, but maybe you were meaning QRIS on the far right column.
We work to support QCC ratings, like the quality care ratings, make sure that we're helping to support those.
Yeah. And this, you've mentioned something really important for the quality ratings, which is you guys, part of our goal in this group is to support DECAL in the work they're doing around quality rated standards that they're currently revising. So our hope is that we can all be champions to support some of the policy systems and environmental change strategies within the QRIS standards that will support obesity prevention and farm to early care. Thank you, Ashley.
Who would like to share next? Lindsay.
Good morning, everyone. Lindsay Jorsad, the Deputy Department Director for Gwinnett County's Department of Community Services. We've got, let's see, how to sum this up, all over the place. So we are one of 14 departments here in the county, and you can consider us as your most out-facing department. So meaning we are here for our residents. That's everything from animal welfare and enforcement, health and human services, senior services, parks and recreation, University of Georgia Extension. You've got Live Healthy Gwinnett. We've got Early Learning Collaborative under Building Brains Anywhere, and then the county's entire volunteer initiative. So we work, of course, heavily in the built environment through our Parks and Recreation and Project Administration teams. We are under that commitment with the National Recreation and Park Association to work towards having green space access within a 10-minute walk for all county residents and visitors. Social service realm is very heavily with our human service teams, whether that's working through adults, families, kinship care, older adults, and any type of need or resource they seek. Their four main priorities right now are housing, transportation, health and well-being, youth literacy, and learning and food. We also, as I mentioned, UGA Extension Gwinnett, of course, every county in the state of Georgia has extension. Government here just oversees ours. They're heavily involved with their family and consumer science team in child care centers, doing some training for those providers. They're working immensely through our community gardens, through our faith-based complexes, for both obesity prevention, nutrition education, and a few other things. I'd mentioned Building Brains Anywhere, focusing primarily on early learning and literacy. They work very heavily with the community collective here, which is called Building Babies' Brains. They're making sure we're monitoring the statistic of how many kindergartners are coming to Gwinnett County Public Schools unprepared. And right now we are at a 49%. So we know 49% of those kindergartners are coming to school unprepared and ready to. And then I'll last mention, food security realm. Volunteer Gwinnett teams work primarily with the Atlanta Community Food Bank. We are still conducting every single week mobile food distributions, quarterly produce boxes, making sure that information is being paired with recipe, food preservation information, and other resources to get families connected back, as we know food is in most cases not the only need that they're seeking. What other services we can provide for this? I think that covers it, Jimmy. Thank you.
I got all that. Gwinnett County got a lot going on. You're doing a lot of good work. Tell me about the child well-being map.
So I definitely want to make sure everyone is aware of United Way of Greater Atlanta recently updated their child well-being. What was before a score, now they're in a refresh, moving towards a map. So they have identified within the metro area neighborhoods from highest area of need all the way down. And we're talking about needs of everything. If that's early learning, literacy, food, housing, transportation, you name it. So they just relaunched this map. I know Gwinnett County, we have 22 identified neighborhoods within greatest need. I believe across the metro area, there are 79 neighborhoods identified.
Great. That sounds like a powerful resource. If you have a link to that, you could pop in the cell there. That'd be great to have in the map. Thank you. All right. Debbie, did you get another volunteer? Is that what I saw?
Well, I don't know. Wanda, are you in a place where you can share? I know you were attending a conference. Wanda, with the Hand, Heart, and Soul Project, has been with the Farm to Early Care and Education space for a long time and is doing some very cool things. I think she's attending the conference. Since I don't hear her, I just want to share two things that I think are really unique and important that contribute to the work that we're doing. One is that at the ECE site that Wanda leads with her mother, this is Wanda Okinawa Meadows, who has been a partner with the W.K. Kellogg Foundation Initiative in the state of Georgia, and has been a champion for quality early
Well, we lost Debbie. She has bandwidth issues where she's dialing in from. And I'm guessing we just have Wanda's autopilot and not actually her. So here, Debbie's getting back on. We'll let her finish her thought.
I'm sorry, everyone. I'm in a very rural area of Western New York with bad broadband. And one of them, she's done a ton of accomplishments. But one of the ones that I think is incredibly unique that could be replicated is that Wandy's early care efforts resulted in her early care site actually hosting on-site farmers market and accepting SNAP EBT from local families who whose children may attend. So that is
And Debbie froze. See if she stays on or comes back or goes back away. All right. Back, Debbie?
I'm going to turn my camera off and stop talking. I just wanted to celebrate Wandy's work.
Great. Thank you. All right. Who would like to share next?
Jimmy, my name is Debbie Hillman, and I am with Black Child Development Institute Atlanta. And BCDI Atlanta is we're part of a national network of that's located across the country. NBCDI has been involved in this space. We created a Good for Me curriculum that was used in classrooms in the early childhood space, as well as doing something with families. Because one of the things we believe is that we cannot improve the quality of life of Black children and families if we don't work together. So we have been involved in this space. We do a lot in the area of advocacy. We have a family engagement initiative. We have received a lot of funding from United Way to do things. And we are very interested and involved in creating culturally responsive practices. Because one of the things that we believe over the years, we have helped programs become nationally accredited, as well as provided technical support for the quality improvement initiative. So we believe that our children and families have lots to offer and are often most impacted by those health inequities and other inequities. But we believe that we can use those to strengthen and not to succumb to.
Right. That's a great perspective, and sounds like you're doing amazing work where it needs to be done, and trying to, again, do this kind of stuff to look at the system, get the different perspectives, so we can see where are those inequities built into the structure. How do we start disentangling that? And I did, so I popped it in there. Populations you serve, and just not to belabor it, but do you have a specific definition? Is it all families of color? Is it specifically African American, Black? How is there a bounds for who you support?
It's primarily African American and Hispanic children.
Okay, great. Thank you for sharing, and thank you for whoever's in there typing. Thanks for catching the things. All right, great. All right, who would like to share next? Anyone?
I could go.
Thank you.
Hi, my name is Melissa Nichols, and I'm with the Latin American Association, all the way at the end.
Oh, yeah, at the end. Yeah.
Yes. Okay. So, yeah, so as far as like, you know, what we do or who do we serve or whatnot. So we do provide services and advocacy and education. And this is me really shrinking down to the bare minimum for the sake of this time. We collaborate with partners to advocate for policy changes that improve access to healthcare, education, and social services for the underserved community. And the community we serve are the limited English proficient, Latinx, Hispanic immigrant community. So we usually refer to them as LEP or mixed status immigrant families. Our work extends across 5 service areas, and that is, education, economic empowerment, family well-being, immigration, and advocacy on a macro level, and micro level too. What geography do we serve? So we are in Georgia, Metro Atlanta. We do have 2 offices in the metro area, so Lawrenceville and Atlanta on Buford Highway. Buford Highway is our headquarters office, and then we do have an outreach center in Northwest Georgia in Dalton. What are the settings in which we mainly work? So we are mainly direct care. We do some policy work, some advocacy, and then community outreach through some of our grants, and we are in office and hybrid. So we do some of our work on the direct level type of work. We do have that hybrid flexibility. And like I mentioned, who we serve, the Hispanic, Latinx, LEP, mixed status families, or newcomers, asylum seekers, and such. Let's see, community leaders that we could bring to the table. I mean, like right now, we are on a few different coalitions. We are part of the food stamp work group with the state through our food stamp grants. Right now, we are starting a new health education prevention initiatives to build that hub, which is one of our 3 pillars for our department. So we are starting to partner and collaborate with other health education and prevention experts in that space to really do the work, because we just got a grant from the Hispanic Federation to do a diabetes type 2 prevention program that we're going to be doing in Spanish. It is 18 and over, but obviously, if we're helping the families and helping the frontliners of the community, which is a lot of times is the mothers, right? We are hoping that can have an impact. Well, we know it will definitely have an impact on the children. Let's see. And then as far as like, how do we measure success? So we do collect data. A lot of the stuff that we do, we're measuring reduced food insecurity, reducing health disparities, homelessness prevention, or keeping folks housed through our homeless prevention program. We measure safety. We also have a victim of violence program. So we do measure safety and sustainability of families that are dealing with those situations. And we're now starting to develop how we're going to collect data for this project that we're working on. We're hoping that we could see improved wellness, not just for the person participating in the PT2, but also measuring the success and wellness of the whole family. And then from the other departments within our organization, they measure things like graduation rates, job security, because we have a job bank and a job program, and just measure success, not just from the bottom, like basic needs program, but all the way to the top to our women's economic empowerment program, where they build their own like businesses and are able to get small loans to thrive and start their lives off. So we do a lot of different things, but as far as this is concerned, the health and wellness space, food insecurity, and making sure that our families have access to health and nutritious food is like our biggest piece of what we do.
Great. Thanks for sharing all that. I'm on the physical activity side, so this is all new to me, and it just is so interesting as an external person, just hearing all this rich work that you guys are doing that I didn't know anything about in Georgia. And I'm going to pick up a little bit on sharing your measures, and you sort of others have said things too, but it spurred for me thinking about your sort of programmatic measures of your success, your number of things that you did, that kind of reporting, in addition to actual improved human outcomes. How are you measuring that? How are you actually seeing if families are doing better? Have they started a business versus how many, entrepreneurial classes did you do? That's different from how many entrepreneurs actually started entrepreneuring, doing in the community.
Right. And I think for us too, like for how do we measure impact in terms of the health and wellness space, we do count applications to access those benefits. We know if they're able to have more healthier food at the table, if they have health insurance, then we know that is a small measure, but still big enough impact because we know that at least they're utilizing those services. And then obviously with this program, we're hoping to look at different outcomes, right? We're looking at, did they reduce, 4 to 7% of their weight and reducing actual, type 2 diabetes, and also, or pre-diabetes, sorry. And then also the, how many minutes of activity they're doing, because we know that those two things are, important. So we're looking at how we could measure with those real tangible, factors, right?
Great, thank you.
I just want to celebrate you, Melissa, because you see the vision of partnership. When I first sent out the email on January 31st, you responded right away and said, we have a new DPP project, and this is the kind of thing that will help us achieve collective impact. So your comments reminded me to invite everyone. Our colleague Savita is going to be putting in the chat our general GSPAN email address. We want to have one-on-one conversations with anyone who wants to share what they're doing, and we can think about how we achieve collective impact. So we answer what's in it for Melissa to engage in this, and how we can also have the entire state benefit from the work that she's doing. So thank you.
Thank you. Appreciate it.
Who would like to share next?
Jimmy, I know Kristen Dixon with Fulton County Board of Health had to step away, so she'd like to share when she gets back, but we invite others.
I'm happy to share. I know I wasn't able to input everything into the document. I keep trying to, but I'm Amy Block. I'm with Children's Healthcare of Atlanta Strong for Life. And we do a variety of things within this space. And really our main goal at Children's and with Strong for Life is to provide families and youth serving organizations all those tools to help raise those healthy, safe, resilient kids. And so we have a lot of programming that is focused on nutrition, on physical activity, resilience, and injury and illness prevention, as well as child protection. So we do a lot. So we work in a lot of those different spaces. So with ECE centers, with the schools, with community organizations, Parks and Rec, Lindsay and her team are who we work with a lot. And also with provider offices. So really working with those clinicians and those providers. So our main population are the children, so from 0 to 18, but then also working with the ECE staff members, with school staff, administrators, and again, those providers and clinicians.
Great, thank you.
Amy, I just wanted to also call out that Strong for Life has been our partner for more than 10 years. And the work that you did in WIC and the WIC system started with some of the very early obesity prevention work. I think it was actually in 1999. So this longtime partnership has made a huge difference in systems change, and many systems, healthcare and WIC in particular, to build capacity to prevent obesity. So thank you for being a longtime partner. Savita's going to share the link in the chat to this document again in case it disappeared for you, and if you want to copy it and populate it at a later time. And then we're double checking the general.
Yeah, so I just shared the link again. Oh, Savita did it too, and then you touched on. Just want to make sure that, because I feel like I've seen different email addresses, so I want to make sure we're giving out the right one. All right, Amy, thanks for sharing. And now, who else as we're dwindling down?
Oh, good morning, everyone. I'm Kristen Dixon with
Yeah, go ahead.
with the Fulton County Board of Health. I'm the director of the Health Promotion Division, which includes chronic disease prevention and several other programs, but chronic is the most salient to the topic of discussion today. So a lot of our work currently is focusing on increasing awareness related to improved nutrition, access to resources that would help people to, those specifically who are food insecure, to eat healthier through linkages from our community health worker to resources such as food banks, opportunities to increase physical activity, and also linkages to chronic disease self-management programs and prevention programs. We also are working to pilot a new initiative called Worksite Wellness at Work, to support the adoption of workplace policies that will support small businesses specifically in their employees leading healthier lifestyles. So it would entail conducting assessments of their policies and practices, making recommendations and providing technical support on how they can improve their environment such that it's more conducive to healthy eating and physical activity. Specifically, we're focusing on small businesses because their resources are not to implement employee wellness programs, just are not as vast as a larger business. It's often sponsored by their insurer. We are, again, launching physical activity campaigns to encourage physical activity with the city of College Park, with the knowledge and the aim that we will shift towards a more PSC approach with encouraging physical activity, looking at some zoning options, and healthy eating, looking at some zoning options, planning options, things like that. We are also working to increase the number of farmers markets that accept the WIC farmers market vouchers. Georgia has some of, despite us being an agricultural state, in comparison to other states, not as many farmers enrolled in the WIC farmers market voucher program. So we're working to increase those farmers that are enrolled in that program. And I think I did indicate breastfeeding support. That's something that kind of goes outside of the scope of health promotion in general, but that's an area that our WIC program works on. But I can provide that information to you, Debbie, at a later time once I do some in-reach to my internal partners here.
Great, thanks, Kristen. Good stuff going on in Fulton County. And I like that connect to city officials. I feel like that, we have some on our team that are, work in various capacities, but I think, that's a layer that often, what am I trying to say, gets added in kind of for show at certain points. And it's great when you can actually talk to some of those city leaders and officials through the process and actually, I feel like you get more buy-in, you get more action by that. So it's great to have those partners to bring to the table.
My previous work was more focused. I was a policy analyst and focused on, policy options for improving health. And so I'm trying to shift our division to more so to that approach as well. It's a process.
As all things are. Population. Tina, you want to talk about your comment in there? Any nonprofit or community-based organization servicing?
Oh, I'm just asking you a question regarding any nonprofit or community-based in Georgia, specifically also on the Asian population servicing.
Tina, I don't know if we've gotten any referrals or partners. So I think this is an excellent point. So if any team members have contacts that we can reach out to, if you can put those in the chat or something. Yeah.
I'm just saying that I'm new to Georgia. Okay, I came from California, so I decided to be a member of the Philippine Chamber of Commerce in Atlanta.
Yeah.
So
fantastic.
We got a few that haven't shared yet. Anybody want to jump in from?
I just wondered if anybody from one of the other HOP or REACH sites were on the call and could share if they're doing obesity prevention, farm to early care. I'm not sure that's one of their required areas, but I wondered if they were doing anything in that space or that would link to it in the nutrition world.
How about our friend from Houston County Board of Health, if you're still out there?
North Central Health District.
Hey, I'm Christine. I'm sorry, I can't get my camera to come on. But I am with Houston County Board of Health. We are a REACH grant. We are doing, so our 4 elements are nutrition, Active living, so physical activity, improving the sidewalks and bicycle lanes in the counties we're covering. We are doing ECE, so farm to school with the early childhood centers and the daycares in our counties. We're also doing breastfeeding as part of ECE as well. And then we're also doing vaccine promotions, so increasing awareness and accessibility to the uninsured and underinsured in our counties. Nutrition, we're gonna produce produce prescription, and then promoting the food services and nutrition guidelines for anyone in the county that serves food. So, and increasing the food voucher programs like WIC. We're specifically covering Baldwin, Hancock, and Washington counties. We're working with the ECE centers, our local health departments, community partners that exist in coalitions in those counties. We're primarily serving the African American population and the lower income areas in the counties that we cover. We've been working with county commissioners, Board of Health members, existing coalitions that are in the counties, and Family Connections. And the way that we are measuring success is looking at decreasing the health disparities within the counties, seeing how many residents are taking advantage of the resources we're bringing into the county, like food banks, voucher programs, vaccines, and the health department services, and then reducing food insecurity within the counties.
Awesome, thank you. And that's a big part. Debbie can talk more about it, but really trying to elevate what she shared earlier, Georgia being the only state that has all different pots of this funding, and trying to figure out how we coordinate and measure the same things in the same way so we can tell a real statewide story. So it's great to have you on board and part of these conversations. Heather, see your hand up.
Hi, I'm Heather Zurcher. I'm with the University of Georgia, and we are the HOP recipient. We are not this cycle doing early childcare education. We are doing nutrition, physical activity, and family healthy weight.
Thank you, Heather.
Yeah, all right. I'm just gonna start calling on folks based on rows in the thing. How about, is anybody from USDA still on and willing to share? USDA person going once, going twice.
And Jimmy, I can share. I'm Juanita with Georgia Head Start Association.
Okay, great.
Okay.
Georgia Head Start. There you are. Go right ahead.
Okay. Let me see. Can I start my camera? Okay. So good morning. I'm Juanita Yancey with the Georgia Head Start Association. We represent Head Start programs across the state of Georgia. But Head Start programs are not one size fit all. So you may find some health activities happening in one that you're not finding in another one. But what they do have unique is a set of performance standards that really guide the work that they do in terms of comprehensive health services. In that all programs have health and nutrition staff that guide and direct the health services and health activities for children, making sure that children are getting health and nutrition screenings. We do have some Head Start programs that participate in the Farm to ECE project. Most of them participate in the CACFP meal planning, where they can help determine and set children's nutritional goals through that food program. The Office of Head Start has been pushing the obesity program called I Am Moving, I Am Learning. So we do have Head Start programs that are participating still. That program has been around for a while, but we do have some programs that are still participating in that. So we do have over 300 Head Start and early Head Start centers across the state of Georgia. Most of our families in the program are from low-income families. They do have health services advisory committees that work closely with their individual programs. So these are some community members that could be a part. And annually, all Head Start programs are required to do self-assessments where they look at their various, education and their health services, mental health services, their disability services. So they're able to do an annual self-assessment where they have to look at their program wide data on an annual basis. And then they can make improvements and adjustments from those assessments.
Great. Thank you for sharing. Are those self-assessments all internal, or do those become publicly accessible at some point?
Most of them are internal.
Okay.
Mm-hmm.
Great. Thank you for sharing.
Mm-hmm.
All right. Who else?
Jimmy, if I could, oh, I'm sorry, go ahead. Go ahead, Karen.
Oh, yeah, this is Karen from Live Healthy Gwinnett. I'll keep it quick, don't worry. So Live Healthy Gwinnett is Gwinnett County's community health initiative. We encourage all of our amazing residents to be active, eat healthy, get checked, and be positive. And we do this by partnering with amazing organizations in Gwinnett that provide free wellness programs. I'm going to pull up this list here to make sure I target everything that we said we're talking about. So our main thing that we focus on is obesity, food security, and wellness initiatives. So of course we have amazing community gardens within our park systems. We actually have 10 community gardens within our beautiful parks in Gwinnett County. We have one that's actually located at a library as well, mainly focusing on teaching our families how to grow their own food, teaching them the importance of healthy, fresh produce, really focusing on providing an outcome for people to not only learn how to grow food for their own families and provide that need, but also how to take care of themselves. We really believe that food can really heal the soul, and making sure that we're providing that opportunity no matter what demographic they come from. We also have amazing mobile kitchen programs as well. And so if people aren't able to get a plot in one of our beautiful community gardens, we go to them at senior centers. We go to after school programs with the youth. We work heavily with Corners Outreach, making sure that we are teaching our young people how to cook healthy meals, and that healthy, fresh produce can be good for you, and that the gardening process is fun. So it's a really great initiative for us, and that covers our Eat Healthy pillar. We also do an amazing mobile recreation program to really target obesity. So we go to neighborhoods like mobile apartments, mobile homes, mobile apartment complexes, I would say, some motels throughout Gwinnett as well, after school programs, things of that sort that are in low income areas. And Lindsay mentioned it earlier, our child well-being map that we utilize, we recognize that map is so great for us at the highest need neighborhoods. That's where we target. And so areas like parts of Duluth, areas like Lawrenceville, we'll make sure that we connect with those apartment managers, leasing managers, and schedule monthly play visits with our amazing mobile recreation unit. We have 2 different vehicles that go out with fun activities. Kids are able to play pop-up soccer. They're able to have hula hoops, various activities to play with. And then, of course, we communicate with caregivers as well, letting them know about upcoming health fairs that we have, free resources that the county offers, things of that sort. And when our amazing partners are able to come out with us, like Diabetes You Could Win, Northside Gwinnett Hospital, they're able to bring out their mobile units and bring out free screenings such as glucose screenings, cholesterol screenings. Those caregivers in those areas of need, low income areas, are able to get free screenings with no questions asked. We're not asking for their information, no names, none of that information. We're just making sure that they get checked and that their numbers matter and that their health is something that we take a priority, because we are not medical professionals, but we partner with amazing organizations who can provide those services. Diving into what partners we could bring to this table that I definitely think we need, partners like Diabetes You Can Win, who really focus on diabetes education and providing free screenings for families in need. Northside Hospital Gwinnett, they're a big partner of ours. They do a lot of our educational programming with us. And then, of course, Open Hand Atlanta, they have a similar RX produce program as well, and they're an amazing partner for us. So that's pretty much it for me.
Awesome. Thank you, Carrie. I think picking up on, I don't know, I want to talk to you about working with the apartment managers from a other project perspective. So I won't do that here, but we're the project doing similar work, trying to facilitate those connections so that the local county infrastructure can help in those settings. And I'm curious if you guys, you and Lindsay being, right, Lindsay, it's the other Gwinnett County, anything to share about how you guys work together already, maybe? Or do you do similar things differently, or do you collaborate?
So Carrie reports to me. She's
you're in the same group. There you go.
Yeah, so she's within the same department, but she really, her and her team take the cake on everything community wellness wise. Live Healthy Gwinnett is 10 years old coming this April. It was first birthed out of Parks and Recreation in partnership with the hospital system here. in the county. And then over the past 10 years and under Carrie's leadership, she's grown it through an immense number of partners that focus on those 4 areas of proactive well-being.
And Lindsay, I think you're having an upcoming event, right? Wendy shared with me that I'm going to try to attend for your Live Healthy Gwinnett initiative. Is that right? Am I?
Live Healthy Gwinnett has a ton of events going on, Debbie.
No,
So
I'll look at. I'm going to look it up. No, I'm sorry. I'm putting you on the spot. I'll look it up and send it. She had shared it with me on a recent, shared it with our team on a recent call, promoting the work that was happening there. So I'll just share it in the chat as soon as I find it in my email.
Okay, perfect.
So you guys are administratively connected. So that's a very tight connection between what you guys are doing. All right. Anybody from Georgia Organics or?
I think Yaza had to leave, but
Okay.
they're intimately involved in coordinating the Georgia Farm to Early Care and Education Coalition, or were up until this year. And then Georgia Organics has a little bit of shift in focus, but they will still participate. The one tool I wanted to remind everyone about that Monica, my team members here from Department of Early Care and Learning, but Health Empowers is the host and main engine behind the early childhood physical activity and nutrition assessment tool. Now, many of you are using different assessments, but this tool was created specific to Georgia and aligned with best practices in early care around physical activity, nutrition, breastfeeding, staff wellness, and family engagement. And that is a tool we are actually trying to bring to the public in terms of thinking about how we can make this tool available to any and every entity that's working in early childhood and collect information that all parties could use around collective impact. So I just wanted to remind the group about that. If you have questions about it, we're happy to share what it is, how it's been used, and what we're thinking about. We're still very much in the planning stages about this, but it is a tool then that everyone would have access to if we get our way, and it would be integrated with QRIS standards. Monica, what did I miss there? And what did I overstate, if anything?
I don't think you missed anything. I know a lot of it's still TBD and trying to figure out what's happening systems wide with decal and quality rated. And I think it's there's a lot of moving targets right now, but there's a lot of opportunity to use, at least among the partners in this space, to use the same tool.
I'll put an overview document in the chat in case anybody wants to download it.
Is there anybody who was not able to populate the table that would like to speak up and share about your work?
Good afternoon, everybody. Or morning, excuse me. I'm Tempest Harris. I'm with Decal. Can you hear me?
Yes.
Yes. And so Decal works, and I'll speak from Decal procurement. Decal works with over 159 counties for CACFP and SFSP, which is the Child and Adult Food Care Program, and then the Summer Food Service Program. And so, in particularly, those are both USDA FNS programs that have to go by a credible guidelines for the federal regulation. And as we know, procurement, that means the sourcing of the foods. So particularly over the last few months, Decal Procurement has been working with organizations and sponsors to ensure not only is it a credible meal, but the sourcing of the food, is it quality and is it nutritious in order for it to, increase the nutrition of the meal as well as the health of the meal. And then as well as Decal has the USDA Farm to School grant that we're working on that's going to be following two organizations and helping them with their procurement initiatives locally, as well as technical assistance. How does procurement look? Again, sourcing of the food, and that's very important. Again, because you can have a menu that represents that looks nutritious, however healthy, but the sourcing of food is very important. So that's what we have working on, and we'll share more in the document once we all convene.
Great, and again, new to this part of the system. So curious that you talk about the procurement and the sourcing of the food. How much of that so it seems like your policies are to set things, but you're not necessarily influencing things out of Georgia. You're influencing, or what I'm getting at is how local are the sources, if at all?
It just depends on the organization where they're sourcing from. So they can, I mean, again, sourcing local, it just, that definition can mean something different to each organization or each sponsor or each childcare or at risk.
So Tempest, just a follow-up question to that. So it's not like USDA says you have to buy within a certain number of miles, right? Like if you're in Augusta, you could source from South Carolina and it could be 2 miles away, for example, exaggeration, but you could also be sourcing over the Florida border if you're in Cook County, 100 miles away, right? They get to define it.
Correct.
Thank you.
Great. Well, unless somebody else that we've missed wants to share their sort of general input, we got space now to reflect on that. How, you know, and again, we want this link is going to stay live. You're going to be able to access these, hopefully come back to it, use it in your meetings. But now just reflect on that. What stood out to you about organizing your thoughts in this way? How might you use it? Who else do you want to share it with and get other perspectives? So now this is the collaborative thinking time of how did that feel? How do you want to use this? Is this useful? Well, I think it's going to be useful for us to look at later, but I want to hear from you guys. Debbie, you came off mute. Helen?
I think it was a great way to see who's working on some of the same things, you know, that you may or may not have known about, that you might possibly collaborate with.
Great. Good. That's exactly one of the ways we want it to get used. And as we circle around, like we started, you know, what people are already doing, where that overlaps with each other to improve health in the state broadly, then also where does that overlap with some of these specific, you know, funding opportunities, the SPAN award, the reach, the hop, you know, trying to, I don't know if triangulate's the right word, but trying to get that full picture so we can see where are the best places to, you know, enhance those existing collaborations or identify connection points for new collaborations on some of the same topics. But thank you for sharing. Other thoughts on the process, how you might use it? Agreed, a bit of analysis might help identify gaps, definitely.
I noticed a lot of people that aren't like totally embedded in the ECE space. Like some of us are, this is what we do 40 hours a week, but a lot of folks, that's not the case. And I almost wonder if maybe there could be like an optional opportunity for folks to get sort of an overview of just all the things impacting like an early care provider. So as we're thinking about this work, people have an understanding of the setting more generally. If that's desired by folks who don't do this all week. I'm kind of curious to hear what others might think about that.
Are you volunteering, Monica, to do that for us?
I think I just did. Volunteer, voluntold.
No voluntold.
No, we're celebrating your expertise. That's what it is.
Yeah, I think it's just helpful, especially for people who are doing all this stuff and then kind of ECE, to understand who they're accountable to and like what's kind of going on in their brain, so that we go in with the SPAN stuff with that understanding.
I would just say the other thing I think, in addition to the topic you mentioned, Monica, is there's a lot of people that in their comments referred to issues around equity and or disparities, and understanding how they're taking action to address those inequities and achieve greater access and services and supports for those who need that. We need to document that as well and understand how we can do that work too. So both understanding the ECE space and understanding how we can get to greater equity in the ECE space. During and post-COVID, I think all of our work in ECE really brought that to the forefront. childcare cost, equity. And I will say, for those of you that are invested in this space, you may have heard, we have a couple of legislators that are very vocal about affordable early care and quality early care. And I think we have to use them as champions for the work that we're going to be doing here.
And I want to share too that, Mike, you're spot on of, that's the nested system stuff. The ECE specific that has that system can be interrogated and described in a lot of more detail than we're doing right here. And I think it's going to continue to be a good challenge for us to have across the span work groups like Gwinnett County, where you're doing different things across all these portfolios, these different topic areas, and really seeing like where do you go deep on ECE and physical activity, and then maybe you're in a more supporting role on nutrition and breastfeeding. I'm making those up right now, but trying to again orient ourselves to what we can offer to this broader system, and that's what we want to build towards in April. And Monica and the group that's part of the action team here, thinking about, would it be valuable for you guys to do a deeper dive using the same tool to get more specific in that area? Are there other tools you're aware of? Are there other ways we can facilitate that kind of learning some of the details and making sure everybody knows, again, we're describing all the elements in the system that can get really big, and then starting to figure out what are the connections we really want to describe, what are the dynamics in that system we want to influence. And so I think this sets that up pretty well. Thank you, Cindy, for joining us. Yeah, Ken, I see your chat, and I think that's a good bridge to part 2. So I'll maybe ask you to share that in a minute as we get there. Sorry, that was a chat comment from me. Other reactions, thoughts, reflections? Hearing none, Ken, maybe I will put you on the spot now and just share a little bit about broadly evaluation perspective of this, where we're going, and that again in the part 2 of this system exploration session, that's where we're going to start talking more about some of these specific indicators and measures and bringing in more of that big picture evaluation perspective. But Ken or Molly, anything to share from the Carnot perspective?
Yeah, hi everyone. I would just say, and this can also wait for meeting number 2 when we get into it, but there's a logic model that covers the whole program, and each of the components of the program have their own sort of logic model that's part of that. And I think as part of this systems perspective, that this group might want to flesh out the logic model a little more, so that it includes all of the activities and the outputs that are expected from those activities, and then how those are supposed to lead to the short, medium, and long-term outcomes of this component of the program. And I think, this can happen in the future, but as we flesh out the activities and what's supposed to come out of those activities, it'll be good for this group to discuss what's important to measure, which of those milestones and performance measures and outcomes are the most important to measure, so that we know, is what we're doing leading to what we're expecting it to lead to. So I think just as this process progresses, we'll introduce the whole idea of thinking about how to measure success, in terms of the milestones of activities and then short, medium, and long-term outcome. And I think we'll just think about that more as we go. And it'll be a good opportunity, I think, to get all of your input on what you think is the most important thing to measure in terms of what you're trying to achieve through this program.
Great. Thank you for that, Ken. And thank you everybody for your time today. We're gonna sort of transition into the wrap up here. But just to reiterate, I'm excited about all this information we got, and this is what we'll be doing offline, is sorting through this, organizing it, working with you guys to continue to share and add to this map so we get that full picture. and don't hesitate to share ideas with us through that email address that's been in the chat. Ideas of what you've got 2 hours on March 18th to do more of this kind of stuff. We have ideas of where we would like to take it, but this is your group and we want you to feel empowered to share your ideas of what you might like to see in that 2 hours. So know that, you know, we sort of, you know, we designed and dictated in some sort of way how this one went, but that's because this is the first one. Now that you're all here, have a little bit of an idea of where we're going. We 100% want to hear your ideas of how can we make sure that these conversations are productive and useful for you, as well as for us as we're ramping up the broader span work and heading into some of those more detailed convenings. But I'm going to hand it to Debbie to do a little bit of cat housekeeping and general wrap up. Debbie?
So before we do that, Molly's with us today, and Molly is helping lead the health communications and health communications evaluation work. And this is important for all of you because part of what we hope you benefit from participating in SPAN work is that we are charged with disseminating information to the general population and to partners on a monthly basis. And that means that we hope to be able to create a communications plan that will embrace the messages you're already sending out as an organization and help further those. Molly, is there anything you want to mention about the communications piece of the SPAN work?
Not just yet. I was only able to join 15 minutes ago, so
okay.
I saw you recorded. I'll have to catch back up and but yeah, I'm here to assist, help tailor any messages to help you reach larger audiences.
Thank you. We are going to be actually putting together a communications plan that will incorporate all of the priority topic areas. So all of the collaborative action team partners will be part of that, and we're going to try to embrace all of the messages you're already giving and will champion. So there's a couple of things I want everyone to know before we depart. One is in our proposal to CDC that was funded, we had included funding for grants. And so the collaborative action teams will come together and think about the structure and scoring and everything associated with that grant making that will happen in years 2 through 5. You as collaborative action teams, we will end up with a collective model, but it might be we're going to fund a collective of people working together, like in Gwinnett, for example, or Fulton, because they already have a collective together and they're going to do work.
Debbie popping in and out again. She reconnects.
Apologies, everyone. And I think one of the things we're going to have to invest in,
I think the issue is the system of broadband in Western New York, right?
Yes. All right. Well, and she had the most details about what's going on next, so I'm not sure I could fully fill it for her here. Let her get back on and share where it's going, and working with Monica as the key partner here.
I'm sorry. Can you hear me?
Yes, say what you got to say fast before you drop off.
I know. We're going to have to invest in broadband in rural areas of Georgia to make sure everyone has access. As Jimmy said, Quality Care for Children will be the collaborating partner. We are going to be updating and looking at the assessment tool as well as the obesity model that we have, obesity prevention model we've been using to use with partners, and anyone is welcome to use that. It's a web-based model, and on a future meeting, we can talk about that. The other thing we want to make sure we do, we want to have a third meeting of the collaborative action team that focuses on the work plan. I put the link, I put the actual file in the chat. So I invite everyone to download that. Many of you have talked about working in nutrition, physical activity, breastfeeding, and obesity prevention. So feel free to look at all of those tabs as well as the overarching activities, communications, health equity, and evaluation. So feel free to let us know, again, that general GSPAN email. If you want to engage in any of those priority topic areas and you didn't get the invitations to those collaborative action meetings, feel free to send us a note. And we want to be able to engage all of you in creating a work plan that models and reflects the collective effort of all of you. Jimmy, what did I miss?
I'm not sure, I was chatting. Having another meeting that'll get coordinated as your CAT team and building towards April. And I think, to me, trying to establish this just open communication through that email channel and others, just so we know what you're thinking, that we're all moving in the same direction, we're all part of this system, and I think we'll all learn together.
And we're trying to help you achieve your objectives, right? That's one of our main goals, is to make sure that we understand what's in it for you and that you'll continue to engage because you're benefiting and getting a value add from participation. We are going to get to the doing, you guys, but year one for CDC is the planning and the assessment and the review, landscape review. So we appreciate you engaging with us as we go through that process to meet the requirement of CDC and then get to the doing in year 2 and beyond. Thank you, everyone.
So I hope you all have a good day, and GHPC team, stay on for a quick debrief. And Monica,